This is Democracy Now!, democracynow.org, the War and Peace Report. That song, Get Up, Get Down, the dramatics here on Democracy Now! We are broadcasting on over 800 stations. On Pacifica and NPR stations, low-power FM, college and community radio stations, on public access TV and PBS TV stations, and both TV satellite networks, Dish Network Channel 9415, Free Speech TV, 9410, Link TV, and Channel 375 on Link TV. That's on Direct TV. We're video and audio podcasting at democracynow.org. Our headlines are also available in Spanish for any radio station to take, as over 250 are. I'm Amy Goodman with Juan Gonzalez.
We end today's show with a more personal take on the healthcare debate. Over the past 8 years, acclaimed actor, documentarian, and playwright Anna Deavere Smith has interviewed hundreds of people, doctors and patients, celebrities and regular folks, Americans and people from around the world, about their struggles with illness, pain, mortality, and the healthcare system. She has distilled a sampling of their emotionally charged stories into her latest powerful solo show. It's called Let Me Down Easy, and it's playing at New York's Second Stage Theater through December.
Anna Deavere Smith has won numerous awards, including 2 Obies, several Tony nominations, a MacArthur Genius Grant. She's a professor at New York University's Tisch School of Arts and is well known for her roles in television shows like The West Wing and now Nurse Jackie. But she rose to prominence with her early theatrical productions, Fires in the Mirror, Twilight, Los Angeles, 1992, presented racially charged moments in contemporary American history using a multiplicity of voices, all based on interviews with real people, participants, observers, politicians, activists. Well, Anna Deavere Smith joins us now in her Firehouse studio, and she is at it again with this remarkable production called Let Me Down Easy. Welcome to Democracy Now!, Anna. Thanks so much for getting up early to do this, because I know you have a busy schedule and you're performing every night. Talk about the research you did for this play.
Yes, well, the play started when I was invited to come to the Yale Medical School, actually the end of the 90s, when people still wrote letters. I got a letter inviting me to come there to interview doctors and patients, and then to present characters at what's called Medical Grand Rounds, which is kind of a lecture series for doctors. I would imagine usually they're scientists and esteemed people like that, not a clown. I consider acting a form of clowning in the best sense of the word. But it was a remarkable experience, and although I did a lot of other things over the last 8 years, I really didn't have a desire to make theater about anything else other than our bodies, their power and their vulnerability. And I went to Yale at a time well before what we now think of as the healthcare debate. But the doctor who invited me to come, Dr. Ralph Horowitz, who's now at Stanford as head of medicine there, saw, you know, the problem then, as I'm sure many doctors did, but also was looking at a critical moment in medicine where the 20th century had delivered a lot of science, but the whole idea of healing had kind of gone away under the weight of that science. And so leaving me, as I left Yale, with the question about where is care in our society? We're smarter, but are we more caring? Do we know how to heal? And that's what really catapulted me into this investigation of doing over 300 interviews on 3 continents.
And then the decision to actually mount a production, and obviously comes at a very timely moment as we're in the midst of this debate. When did you decide to actually mount the whole production?
Well, that really happened as long ago as 2005 that I started thinking about it as a production. And I've had 3 productions at 3 other theaters before it came to New York. So this is just serendipitous and, I suppose, lucky that, or at least I'm happy that it's against the background of the political debate, because it means that audiences come to the theater already thinking about this and wondering about it and maybe fretting over it. And then what I've done is just a piece of a larger kind of a discussion that's going on. And that's what I try to do in all of my work, so I'm glad that the timing turned out that way.
I mean, what is incredible about your one-woman shows is you are one woman, but you are many, many people, and you transform without even changing your clothes, and suddenly we are with you as an old woman, as a kid, we're with you as a man, as a woman. But tell us how you met the late Governor Ann Richards.
Oh, well, that's a really nice question, and you're the first person to ask me that in this time. Actually, I have a very good friend who's a brilliant writer. She wrote The Lion King. Irene Mackey, and she introduced me to the governor, who she'd had an opportunity to meet because the governor was a friend also of Lily Tomlin, and my friend Irene had written for Miss Tomlin, and so that's how I met her.
So let's play a clip from Let Me Down Easy. This is Anna Deavere Smith playing the former governor of Texas, Ann Richards.
No, I was not the first woman governor of Texas. Well, in the 20s, there was Pa Ferguson, who was governor, and Pa was married to Ma, and Pa died. And Ma became governor. Now, she was the one, when asked about bilingual education, who said, if the English language is good enough for Jesus Christ, it's good enough for everybody.
Anna Deavere Smith playing the late Governor Ann Richards, who died of cancer.
Esophageal cancer, yes.
And talk about your conversation with her. Where did you meet her?
I met her at MD Anderson Cancer Center, one of the people who has really helped make this show possible, a wonderful donor in Texas who was also a friend of Governor Richards, Chula Reynolds, organized for me to go to MD Anderson Cancer Center, where I spent a very intense week interviewing all kinds of people, engineers, nurses, patients, doctors. And Governor Richards at the time was undergoing a very progressive therapy, proton therapy, and a proton therapy center that had just started, had just opened. And I knew Governor Richards very well by that time. And so I went and spoke with her. We had dinner together in Houston. And unfortunately, we lost her within 4 months after that interview.
You couldn't hug her, could you?
Couldn't hug her, no.
Well, maybe
no.
she let you.
Oh, she did hug me when I came in, but you're remembering a line in the play where she says that due to the kind of her vulnerability to the treatment, she's not allowed to hug people or shake hands.
One of the other characters, you played Ruth Katz of Yale Hospital. How did you meet her?
Well, she's one of the only, she is the only person still left from that first Yale project that I did. And she's now busily working, by the way, in Washington with Congressman Waxman.
Well, before you tell us anything about her, let's go to the clip of Ruth Katz.
And an oncology fellow who's, which is not one of our full-time faculty, but someone who's in training here, specializing in oncology, came into my room. I want to apologize, but we can't find your records. Could you tell me what kind of cancer you have? I said, this is appalling. He said, no, hey, it's not just you. It happens here quite a bit. I said, I am appalled for every patient who comes on this unit. And I had to go through from like the beginning my whole story. Well, eventually, I'll tell you as an aside, eventually I knew, I could tell by his question that he was going to get to the question of, do you work? And I've never advertised my position around here. I just want to be treated like everybody else. And so, you know, he says, do you work? You know, about midway through his questions. And I said, I do. And he said, are you working full time? And I said, I am. And he said, where are you working? I said, I'm associate dean at the medical school. Now he looks up. At this medical school? I said, at the Yale School of Medicine. He found my files within a half an hour.
That was Ruth Katz, a patient at the Yale New Haven Hospital, played by Anna Deavere Smith.
It's amazing. And it happens, obviously, in hospitals all the time, that those people who are well-known or are well-connected get a kind of treatment that the average person doesn't. And then this vignette of yours captures it perfectly, what it's happening all the time.